Can you reverse diabetes? Okay, so you click this because either you or someone you care about has diabetes. Maybe you just found out and you're wondering, oh my gosh, am I doomed to this lifelong problem of having to inject myself with insulin? Am I going to have trouble with my eyes and my feet and my kidneys? Is that a guaranteed end result for me? And I'm here to tell you, for type 2 diabetes, it does not have to be that way. This is a thing that can actually be managed and in many ways eliminated depending on how you look at it and depending on what you're willing to do. So let's get at it and let's talk about it so you can learn how to deal with this. I really think this is far more manageable than most people believe it is. To understand diabetes, you have to really think about the way that someone who doesn't have diabetes processes carbs and sugar, because the difference between how they do it and how someone with diabetes does is really the important part. So you start to eat carbs or sugars. That's potatoes, that's rices, that's breads, that's actual sugars, candy bars, ice creams, sodas, stuff like that. And you put it in your mouth, and what happens is your body digests that, and then you end up with all that carbs and sugar floating around in your bloodstream. And once it is in your bloodstream, then your pancreas starts making something called insulin, and your body uses that insulin to try and take the sugar out of your blood and move it into your fat cells, right? That's how you end up being a little bit bigger. You know, there's maybe a little bit more of you than you used to be. That's because your insulin is working and your body is using the insulin effectively, and it's taking all those carbs and sugar that you eat and it's adding it to your waistline, and that's how the scale moves up. But you're watching this video because your body or the body of someone you care about isn't quite operating that way. At some point, a doctor told you, hey, you're pushing into diabetes and we've got to start having some talks about medicines and all that sort of stuff. So let's talk about how, if you're diabetic, that your body actually starts to process all this stuff. If you are a type 2 diabetic, that's what we're talking about, type 2 diabetes. If you're type 2 diabetes, your body makes plenty of insulin. And the insulin is fine insulin. It works just fine. But your body is not reacting to the insulin. You've got some resistance. Your body's just not processing it properly. And the insulin isn't able to do the things that it would normally do in somebody who does not have type 2 diabetes. And the problem with that, you'll see here in this slide, is you're eating these carbs, you're eating these sugars, and it just gets backed up into your bloodstream. So diabetes is really the status of having too much blood sugar in your bloodstream. Your body can't handle it. So when your doctor sees that there's too much blood sugar backed up into your bloodstream, your doctor's going to come to you and they should be telling you that there are two things that you can do. The first is the thing that most people end up saying to start with is, hey, I'm a doctor, I've got medicine. I can give you a lot of medicine, and I can pull in all sorts of different types of medicine, some of them with needles, some of them as pills, and I can give you a lot of medicine, a lot of expensive medicine, a lot of work, and I can really, really try to use medicine to really beat that blood sugar out of your system, out of your bloodstream, and into your waistline, right? And that's what controlled diabetes looks like to some people is, hey, I didn't change the way I ate, and I'm just now on a ton of meds, and so the amount of sugar that stays in my bloodstream looks normal, and they'll call this controlled diabetes. But I would like to propose to you that maybe there is a better way, a healthier way, if you will, of controlling type 2 diabetes, reversing it even, and dealing with the amount of blood sugar that causes you to be classified as diabetic by just the way that you eat. You know, if the trouble is that there's too much blood sugar in your blood, right? There's one way I can take the medicine and I can try and drive all that blood sugar out of your bloodstream with medicine, or we can back up to the supply side of this issue and we can try and control how much blood sugar gets to your bloodstream by controlling the amount of sugar that you eat, the amount of carbs that you eat. And that's a thing that a lot of folks, I mean, it's a change of habits. Of course it is, right? But you can actually reverse the status of having too much blood sugar in your bloodstream by the way that you eat. So let's talk about that for a second. Do I need you to starve to do this? No, you actually do not, right? You can eat plenty of food. You can eat tasty food, but you do have to start looking at the types of food that you eat and which ones your body is essentially going to treat like a candy bar. I've got a whole video that I've already done that talks about how to stop drinking your calories. And if you're a type 2 diabetic, that's one you probably want to check out after this. But you also want to think about things that a lot of people, particularly here in America, right, we take for granted. You want to think about your pastas. You want to think about your breads. You want to think about the rices and potatoes, all those things that are really heavy and starchy in carbs and sugars. And don't get me wrong, they're tasty. I like all those things. But if you're dealing with diabetes, your body does not process those well, and that sugar just loads up in your bloodstream and puts you in that diabetic status. And that blood sugar being so high is what causes problems with your circulation, causes trouble with your feet, with your kidneys. That's what causes trouble with your eyes. It causes all sorts of problems. And if you can control that, you have essentially controlled diabetes, and it's something that you can often do with your diet. So I'd like to suggest that you talk to your doctor, talk to your nutritionist about the potential benefits of talking about keto, talking about low carb, and finding ways to reduce the supply end of things. And you're going to find that if you start doing that, the amount of medicine that your doctor has to give you to control this is going to eventually start going down. The way that you have to live to control your diabetes and the reducing the amount of carbs and sugars that you eat is probably going to cause you to start losing some weight. Roughly 80% of diabetics are struggling from being overweight. Your weight will get better. Your blood sugar control will get better. And I think you're going to find that it is far more possible to manage and even reverse your diabetes without a ton of medicine than you might have thought was possible before. Don't give up. This is not some hopeless thing. This is not a death verdict that has been laid on you. There is something that you can do about this. You can deal with diabetes and in many cases beat it in the way that you eat. Go ahead and leave some questions below. Check out some of the other videos that I've done. I really think that we can do a lot with this, and we can help you get through this. You can beat it.